Before we get going, is it at all possible that this turns into a wrestling promo? Yeah, it might. At least at the time of filming. Last week, I was in New York. A lot of amazing things going on in New York. I would tell you, I love going back because it just seems like it's like less pressure. Even when in Greenwich, you get in and get out, gone. I had very little investment in the city. Didn't stay in the city. Now when I go, I stay in the city, and I've actually said this for quite some time. If it was only about business and not necessarily the different versions of how we can define quality of life, never, ever should have left. As far as staying the course from several years ago, I don't even know the right words to say beyond proud of what Kyle Balzer has been able to do in terms of kind of taking the ball, making every cut and scoring every touchdown. And we're now back up to, I think, an additional 3 therapists, about to be 4, multiple locations in New York City, multiple discussions all the time. That's kind of the stuff that I handle. I think a lot of people don't even know I moved to Florida. Other people think I'm in Florida. They don't know New York. I don't broadcast, my whereabouts at all times. But anyway, when I was in New York this last trip, I finished at 12 and I had the car ready to take me to the airport. And the week before, I called a special operations call, and Charlie, we'll take the car to this other location and we'll fly you home from this other location. You'll still be home at night. Given the individual that was asking for this, no is not an option to have this. And part of the reason why, not only was it for a very, very close friend, colleague, somebody that I look up to, admire quite a bit. I don't necessarily care if anyone has an issue in 2024 of saying this, but anytime a man asks for anyone to look after their wife or children, I find that to be incredibly special. I have found in myself telling other men thank you for some of the opportunities and situations that they have provided for my wife, for Allie. I think most of us know that there is something special. So now I'm in this very special place. Somebody very important asks me to look after their wife. Like, the answer is yes. And now, I'm on. I need to nail this. Also because this gentleman's wife has had significant pain since February. A rigmarole that we'll get into, to have a clinical lesson in this video, but also some very unfortunate social messages that all start out very positive and finish very positive. But you can probably see, well, if somebody's in pain for months, that means somebody's not getting it done. And that is okay to say, because at no point are we ever going to get into suggestions, despite the words of hyperbole and sarcasm and drama that I will use to illustrate my points in this potential wrestling promo. We'll always have to be allowed to say people can be really, really nice and really, really altruistic and suck at what they do. That's okay. I'm not immune to that as well. People can say, if I'm not getting it done, I want that accountability, and I don't think other people even think of being accountable for poor decisions because they think they're doing the best that they can. But if the patient or client is not happy, then this is something's missing here. All right. On the way up, I guess I messaged my guy and say, can you send me the MRI report? This is back and leg pain, significant, multiple epidurals. I'll get there. So send me a couple images, and it's obvious that there's multiple herniations on the sagittal view. He's sending me 5 things, and that's okay. Like, that really, in these situations, what I would prefer to have is just the radiology report, because remember, we're always into what we say, what the patient does, and the truth. The MRI is the truth, but the truth doesn't always have to be relevant. As far as the radiology report, unless it's absolutely absurd and ridiculous, and or there's language that suggests movement while in the tube, I have to say that the radiologist is better at reading those messages than me. I'm not looking to challenge what they're saying, again, unless it's absolutely absurd. We'll challenge it properly when we draw those links and try to write that red thread through what the patient says, what the patient does, and the truth. So I did not get the radiology report until we got to the house, but what I did get was a message, which I'm not going to read what the physician told my guy to tell me, because that's when this starts to become a heel in wrestling, because I don't have anything positive to suggest about this individual's clinical message or his choices in social communication. Just a bunch of nonsense. My guy showed me what he had asked him. I have a PT coming over to the house can you give me a few words as to what's going on with insert name of wife? That was not what this gentleman suggested. He gave a bunch of instructions, with also under the assumption that whatever I would be doing, number one, he did not like, he did not recommend. He said, I usually do not have these types of patients dealing with physical therapy at this point. Mind you, initial episode like February 2nd. And this guy doesn't want physical therapy involved. That's what this message was. As well as use good biomechanics, or, you know, just, it was disgraceful. It was, and my message back to my guy, I said, insert name, I said, yo, what if this is wrong? And he said, well, the MRI says, I said, man, you know I care about MRIs. I'm not that guy. But it is incredibly challenging in any situation to create a real solution, much less overcome previous trust. Because I'm pretty sure this guy was really nice to talk to, and he got all this stuff. So there's 3 epidurals that he provided, and man, you know, another physician came to the house. Yeah, you know what happened here. And you know, because now I'm on, because I want to be on, and now I'm double on. And this is a level of accountability that I don't expect other people to feel. But now maybe you can, when people ask me, what do I do? And I'm a physical therapist, just like, you know, however many people are watching this. And I think maybe the way I used to play sports, my interest in powerlifting and just lifting in general, this is it.